It really is an unpredictable thing that I would end up here talking with you, of all people. I've talked to a lot of healthcare audiences, not this particular one, as Alan said, but far more important is that my background is in typesetting, you know, like which used to be the way you do graphic arts, but then along came desktop publishing and the internet, and nothing in the industry where I used to be a star even exists anymore. Right? There were a whole bunch of people who got really upset and threatened and everything. But I'll tell you, the good news is when your industry turns inside out, if you were smart the first time around, chances are pretty good you're still going to be smart. And you'll find a new way of using your smarts. Well, this is the book. There was a copy of this book in your bag at registration. That's my doctor, Danny Sands, who is the co-author of it. And you'll hear in the next half hour or so how that saying, that slogan, it's actually a chant at the end of my TED Talk. I got them chanting, "Let patients help," how it came to be. I will be explaining what the word e-patient means, and at the bottom right, you'll see the logo of the Society for Participatory Medicine, which, as one of the umpteen improbable things about my story, I ended up as one of the 13 co-founders of a medical society, which is not typical for a guy from the typesetting industry, right? So, fundamental principle for understanding healthcare: patient is not a third-person word. And this is important because when I started getting asked to give speeches a few years ago, a whole bunch of people talked about patients as if it was people out there on Michigan Avenue. Right? And nobody got it into their skull at first that sooner or later your time will come when you're the one who's saying, OMG, you know, is my kid going to be okay? Is my wife going to be okay? Am I going to be okay? Is my mother? I don't know. And I say this because in a whole bunch of things, especially if you've been in a part of the industry that is not patient-facing, that is not touching the consumer, it's easy to think about patients as those strange people out there who don't do what we tell them to. You know, they don't click our app or whatever. So please transform your experience. It will help your company unless they fight you. It will help your company if you start thinking about this, all of this, in terms of I'm the one whose relative is in deep trouble. It's not always cancer like it was with me. It could be chronic conditions. Anyway, a corollary of this is, as I say, it all looks different when you're the one with the problem. Now, a little bit about how I came to be here, because I never set out to give speeches to medical conferences. I was a high-tech marketing guy in graphic arts. I'm a data geek. I do unnatural acts with Excel. I'm sure some of you belong to that club with me. I love to follow tech trends and automation. I really am a data geek. One of my obscure claims to fame long ago was that I wrote the world's fastest software for typesetting business cards. Now, ladies and gentlemen, this is a niche market, okay? There are not a whole lot of people in there, but the company I was partnering with was a specialized printer, a 50-year-old family business in the Twin Cities. And they realized back in the 1970s that 3M, for instance, the purchasing agents would type all the information onto a purchasing order for your business card, name, address, phone number. They didn't have email in those days. And I'll tell you, that is a nasty kind of typesetting work to do. Because then they'd put the envelope in the mail, and somebody would open it at the typesetting shop and read all that stuff and type it again. Horrible work. Well, they said, what the heck? So they got, in those days there was no internet, they got what was called a leased line from the phone company, one strand of copper, all the way to the 3M purchasing department, and let them type the information into the computer. And then I wrote software that would make everything come out. And anyway, one thing we learned, and this is really important, as America starts to digitize healthcare, is that if there's garbage in the data in the computer, you get high-speed garbage coming out of the printing press. Well, this is no small issue because we've got a whole bunch of people talking about how IBM Watson is going to read everything that's in all the electronic medical records. Well, okay, it may be smart at Jeopardy and all that, but you know, one of my chest x-ray reports, when I started looking at my medical record, as you should do, identified me as a 53-year-old woman. Now, I'm not sure where they got that idea. But if they started drawing demographic conclusions based on stuff like that, and it wasn't just, this was not a fluke. I mean, seriously, the easiest way to start becoming an e-patient is to go ask for your legal copy. They are not allowed to say no. Your legal copy of your complete medical records and everyone in your family. A big study on the front page of the Wall Street Journal health section in June 2014 said that Geisinger, a big distributed health system in Pennsylvania, had done an audit of some subset of their records and found 80% of them contained mistakes. Some of them are not important, like mine. Nobody was going to do the wrong procedure on me based on that mistake. But when my mother was discharged to rehab after a hip replacement a few years ago, somehow her thyroid condition came across backwards. She's actually hyper, and it came across as hypo. And the best doctor in the world could have prescribed the wrong medicine and done harm to her. So, and as it happens, I have two. There's a common sociological group that I've learned about that I call the alpha daughter in many families. It's generally the middle-aged woman who comes in and says, all right, you know about her allergy to this? How about this? Did you take this into account? No, she's not on that medicine anymore. My two sisters said, could we check the chart? The rehab place said yes, and they found the mistake and got it fixed at no cost to anyone. This is what somebody like me means when I talk about patient and family engagement. It's the patient and family as active participants. I am way off script. Let's move forward. In 2007, I discovered that I was almost dead. You'll hear a brief version of that story today. And I got better in less than a year. Stage 4 kidney cancer, and diagnosed in January, and my treatment ended in July. Some people think that patient empowerment is anti-medicine. Nothing could be further from the truth. I did not go out on the street and hope I got better. I went to doctors. But you'll also hear how I was involved and miracles. In 2008, I learned about the e-patient movement and started blogging about it. And in 2009, my doctor and Sarah and I and a bunch of other people were involved in founding the Society for Participatory Medicine. That's where the patient participates instead of sitting there and saying, I don't know, you're the doctor, you tell me. And a weird thing happened. I discovered garbage in my medical record, and I couldn't get a straight answer out of my hospital, which is a great hospital that just saved my life. And I ended up doing a blog post after 2 months of back and forth and never getting a straight answer, much to my amazement. I mean, so the blog world and social media exploded, but the thing that was odd to me was the Boston Globe called 3 days later and said, we think what you wrote is important. I'm like, what? People have said that if what happened next was a Disney movie, everyone would say this only happens in Disney movies. There's the blogger in Nashua, New Hampshire, writing a blog post. The newspaper calls. They ran it on the front page. So you have the front page of the newspaper spinning out of the movie screen, and people started inviting me to Washington to policy meetings. I'm not kidding. The first time I showed up there, big horseshoe-shaped table of microphones, I literally said, it's in the Federal Register, I feel a little bit like Reese Witherspoon in Legally Blonde. I'm not sure how I got here, but I'm glad you invited me. Well, and while all that was going on, for the first time, a medical conference invited me to give the opening speech at the Medicine 2.0 conference in Toronto that fall. And they asked this question that I'd never heard before, which was, what do you want the title of your speech to be? We've got to put it in our brochure. And the third time they asked, I said, I don't know, just call it, give me my damn data, because you guys can't be trusted. And they did. And this is one of the sayings in Sarah's video earlier today. And I'm glad to be alive and I'm happy to help. Well, let's keep moving. In 2010, I felt a calling and I started doing this full time. It was rough. There was no precedent for a patient to make a living giving speeches at business conferences. But I had worked in marketing and I knew how to give product introduction speeches and how to be responsible for whether what I say is of interest to each individual audience. I don't have any canned speeches. Some people ask me to submit my speech a month in advance so they can put it in the computer. It's like, my last change on this slide was 12 minutes ago, you know. In 2011, I got invited to do a TED Talk in the Netherlands. went international. 2012, I started being invited to speak at medical schools, and none of this is anything I ever applied to. So I'm just, as I said, I'm glad to be alive. I'm trying to move forward. In 2015, the Mayo Clinic even had me, I don't even have a master's degree, much less a doctorate, had me be their visiting professor in internal medicine. The reason I mention this is because if it were just me standing out on a street corner waving signs or something, that'd be one thing. But what really motivates me and gives me the confidence to speak like something real must be happening is because all these people with a lot better credentials than me keep saying, say more. So now it's 600 events in 19 countries, 1,400 blog posts. Oy. All right, 19 articles in peer-reviewed medical journals, 2 book chapters. Here's our problem. There are bad guys in the world. I was wondering last night, why are we here looking at a submarine? You know, but I thought about it. Sure, I'm sure it's a very unusual venue and all that. But, you know, if you looked at the story of what was going on, you know, how those submarines would stalk innocent passenger ships, maybe merchant ships for war, but there are bad guys in the world, you know? And the Enigma code-breaking machine, or the code machine that when they captured the sub, that gave them access. I read up on Wikipedia about it today. It didn't lead to breaking the Enigma code, but it was an important contribution along the way, leading ultimately to the big breakthroughs. And, you know, even with all the stuff we talk about electronics, I stood there in the presence of these big propellers and I thought, you know, there's an awful lot in the history of humanity that was just physical stuff, people coming up with ways to move things one way or another. The world has changed a lot today. They did all of that, even the code machine, with nothing digital. They only had things. But here's an important thing, and I speak from experience, because the industry where I used to be a star is dead. If you live long enough, things change. Now, if you combine that with the fact that I tried to die in my 50s, and I didn't, so I'm still alive, so I still got to find a way to eat. Well, I better adapt. And if you want to bring your company into the coming decades, you need to be thinking about this also. Bercy, who actually wrote an amazing blurb on the back of my book yesterday, saying he reads science fiction so he can better understand the future. Well, yeah, he's got a few more decades of future in front of him than I do, but still, the point remains, you know, and I love how he has people visualize what that future is going to look like. For those of you who weren't there yesterday, that's a medical drone flying supplies into an area of Rwanda where there are no roads, and meanwhile, the doctor who's treating the woman, the patient has a 3D printed cast on her forearm. That's a reality today. So we want you to think ahead. And Stuart Brand, the Whole Earth Catalog was originally a hippie self-survival book. I love this quote, you know, if you're not part of the steamroller, you're part of the road. So the reason you come to things like this is so you can learn about what it's like on top of the steamroller, okay? Here's my doctor. Notice how he holds the computer. Your doctors may or may not do this. So often, because the usability of this first generation of electronic medical records is terrible, the doctor or nurse will have their nose buried in the computer. There's a famous picture going around of where a little girl did a crayon drawing of her doctor visit, and the doctor is smiling, looking with his back turned on the family, right? Dr. Sands has always had the computer between him and me, so I can see what's going in there. You know what? Sometimes he makes typos. I say, no, it's the left hand, not the right one. You can ask for this. This is called the triangle of trust, and there's literature about it. As I said, we were among the founders of the Society for Participatory Medicine. Sarah yesterday, you'll notice that in this slide, she talked about participatory. That was this morning, wasn't it? That was not yesterday. Phew. Participatory co-design. It's a big thing, participatory democracy in the world, so participatory medicine. Tom Ferguson was sort of the patron saint of this movement. I never met him. He died a year before I came along. But he was a real visionary. Back in the 1980s, He had just come out of Yale Medical School, and he published a magazine and a book called Medical Self-Care. He knew that most of what we do is take care of ourselves and our family at home. You get a cut on your finger, you put a bandage on it. And he knew that access to information was the main thing that limited how much stuff we could do. So he published these books, and when the web came along, he just nailed it. He saw what we would be able to do, and he coined this term, e-patients, equipped, engaged, empowered, enabled, educated about evidence, whatever you want to call it. And all these people across the top were people that he spotted in the wild. Like he knew Dr. Sands in the middle, because Dr. Sands had published the first journal article about how to do email with your patients without ruining the doctor's life. That was 20 years ago in 1998. So if your doctor will not do email with you, your doctor may be a little bit behind the times, you know, which is ironic because doctors commonly will say, well, I study the evidence, which is why I know more than you do. Well, so they better be up to date if they want to make that claim. Anyway, also in 2009, Health Leaders magazine, which goes to tens of thousands of medical executives, got wind of this and came and talked to a bunch of us, and much to our surprise, they made it a cover story, September 2009. Now, I'm a former hippie back from the 60s and 70s, so I'm really, although I don't act much like a hippie these days, I am really interested in social change. So for me, my alarm bells went off, also having become a marketer. We didn't have a PR agency to get us coverage like this. It was the editors of the magazine that said that the patient of the future, right? They portrayed it as somebody sitting there with a laptop and correctly said it's a new relationship. It's not that the patients themselves are different, but it's a new relationship. Now, they sent photographers to talk to a bunch of us and get pictures. I assumed it would be the usual black and white headshot. So imagine my surprise when this ran a full page on the table of contents. It's like, I would have worn a different shirt, you know, if I'd known they were going to do this. But on the other hand, when you think about it, what the editors of Health Leaders were saying to their readers was the patient of the future is a middle-aged slump with a paunch sitting at home with his laptop. Then every year, they run 20 people who make healthcare better. Number one on the list was Atul Gawande, who happens to be the guy that was just hired by Amazon to run the health thing. Phenomenal surgeon, writes these incredible essays in the New Yorker surgical checklist book. And Dean Kamen was number two, the guy who invented the Segway scooter, but he also has done a lot of medical things. And he was first honored in healthcare back in the 70s for inventing the first wearable insulin pump. It was a backpack. So somebody with type 1 diabetes could go outdoors. This year, he was honored again because of what his company was doing with amazing robotic limbs for amputees. So clearly, these are like world-class stars in the sky. So imagine my shock when number three on the list was me in that stupid shirt. It's like, guys, you know, if I'd had a PR agent, you know, I would have said, I'll send you a different photo. But importantly, number four, Dr. Sands was right next to me. What the editors of Health Leaders, this is when I started to really think, what the heck is going on here? Because this wasn't the result of a successful PR campaign. I mean, some people have said that I came back for a reason. I wouldn't be that egotistical, but as long as it keeps coming, I'll do it. What the editors of Health Leaders were saying was that this rebalanced patient-physician relationship belonged on the same page with Atul Gawande and Dean Kamen. Now, this was when I started to feel the call to do this work. But I've seen plenty of people who have an idea that they passionately believe in. There's got to be a market for this, and they've gone bankrupt. You know, so I wanted to be realistic. Am I really an indicator of the future, the way that magazine said? So I looked for evidence. Well, who's getting online? I've been online on CompuServe since 1989. CompuServe, you know, before the internet, modems, right? 20 years later, 83% of US adults were online. Okay, so maybe what this little monopoly piece was doing is an indicator of the future. But that's only one data point. Having one data point is another great way to go bankrupt. So I looked around for what is something else I've done in the past that has caught on. Well, romancing online. Yes, indeed, ladies and gentlemen, I found my wife on the internet in 1999. We were one of the first success stories at Match.com. I'd been in a distance relationship with a woman in Florida. I live in New England. That wasn't working, and when it ended, a mutual friend from CompuServe said, hey, have you heard about this? I went online. Virginia lived 13 miles away from me, and I was like, I'm going on a date in a car. This is great. And you know, I'm a data geek. I give speeches. A year after we met, I got hired to do a speech about data in Paris. Tough. So we got hitched and made a honeymoon in Paris out of it. This is great. There she is on top of the Impressionist Museum. 10 years later, 1 in 8 weddings in the US was, if you live long enough, things change, right? 1 in 8 weddings in the US met online, and 2 years after that, it was 1 in 5 couples met online. Today, it's like obvious, no big deal. You notice the rate of change of what's normal is really accelerated. Now, there's an important parallel here. People say patients should stay off the internet because there's garbage on the internet. Well, I assure you, before I found Virginia, I went through some suboptimal search results. And if you've ever been on eHarmony or, never mind Tinder, I've heard about Tinder, but I have never been there, and I've heard about swipe left, but that's as far as it goes. When I started using this slide, Tinder didn't exist. You see my point? Well, so a short version of my cancer story. I went in for a regular physical at the end of 2006, January 30th, 2006. And I had a bunch of things. I'd moved away to the Midwest for a few years, and I'd come back, and we went through a bunch of things. One of them was I had a stiff shoulder. It was no real pain. It was just like, I just would rather do this than reach up. So the doctor sent me for a shoulder x-ray on January 2nd. The next morning is a moment, some of you may have something like this in your history. Again, this is where it all looks different when you're the one with the problem. You know, we hear statistics. Well, I vividly recall 9 a.m., January 3rd, 2007. I remember what my desk looked like. I remember what the carpet on the cubicle partition looked like. I remember the Sony desk phone with the gray LCD display 09:00. The phone rang, and it was Dr. Sands. And he said, Dave, the radiologist called me, and I pulled up the image on my screen at home. And I thought, can I pull up the image on my screen? Well, we didn't have screen sharing then. Today we probably could, especially if you're going to do a teledoc sort of thing. He said, Dave, your shoulder's going to be fine. It's just a rotator cuff problem, but there's something in your lung that shouldn't be there. That's shadow. This is what they call an incidental finding. By the way, incidentally, there's something in your lung. He said, we don't know what it is. It could be a fungus. It could be a scar from some old infection, but we need to find out. So I'm listening, and mind's racing. He said, call this number and make an appointment for a CAT scan. Well, the CAT scan came back, and this is one slice of that image. This is a golf ball-sized tumor about here in my left lung. I had 5 in both lungs. So now we knew it was cancer of some sort, and lung cancer doesn't look like this, which means it was metastasized, spread from somewhere else. So I went from just feeling kind of tired in the evening to discovering I had metastatic, widely metastatic cancer of some sort. Eventually, an MRI showed that there was a big dark mass, 2 big dark masses in my right kidney. It was kidney cancer, stage 4 kidney cancer. Some people do not want to know, and that is absolutely fine with me. There's this concept of patient-centered care, and it requires knowing what's important to every individual. And that's not just biologically, the way we'll be talking about later, but also sociologically. The essence of good care. If you have ever been scared witless about what the heck is wrong with me or my kid or somebody, what you need at any given moment is a really important part of the experience, as well as having excellent doctors. But my wife's a veterinarian. She knows I'm not a dog, but she's seen lots of mammal tumors. And we looked on WebMD, which we knew was not the ultimate thing, but we just wanted to know as much as we could. Prognosis for any treated renal cell cancer patient is poor. Almost all are incurable. Now, when you didn't know a week ago that there was anything wrong, to sit there and have that staring in your face, and I apologize, sometimes I get emotional, sometimes I don't, but it's real, you know. Turns out, this is a generic diagram from the website of the drug I eventually got, and totally by coincidence, there's that thing in my lung. I'm a poster boy. The first pain I had was in the left leg. Turns out I had a big metastasis in the left femur. That shows one in the brain. Mine actually was in the cranium. I have a moth-eaten area at the back of my skull to this day. And because I've always been an overachiever, I had these additional tumors, one in this arm. And if you look at the head again, just before my treatment started, I had a kidney cancer tumor grow out of my tongue into my mouth. I had a kidney cancer tumor growing in my tongue muscle. Only the most aggressive cancers grow in muscle tissue. I had not known that. The median survival, the best available data, said that half the people in my condition were dead in 24 weeks in the only study that had ever been done. And if you want to talk about something that will focus your attention, it's like, what the heck? I'm not going to see my daughter get married. 24 weeks. This was January. That would be September. What's the... let's see, what will the weather be like the last time I look out the window? And I pictured my mom's face at my funeral. We'd just buried Dad a year and a half earlier. What's she going to look like when she buries her son? But after the shock, you're left with the question. And the reason I go into this is because some people wonder, well, why would patients want to get involved? Just let the doctors do their work. Well, some people want that, and some people say, for heaven's sake, can I help? How can I help? I chose to get engaged, get to work, do everything I could. Importantly, once the tumor, the biopsy was confirmed that it was kidney cancer, Dr. Sands referred me to a patient group on the internet. Yes, ladies and gentlemen, my doctor sent me to the internet. A group called ACOR is a network of cancer patients. They've now grown into a company, smartpatients.com, free for the patients to use. And within 2 hours of posting remember I said I learned how to behave in online groups back on CompuServe. Within 2 hours of posting my first message, my patient peers told me, this is an uncommon disease. Find a hospital that does a lot of cases. They also said something totally non-clinical. Welcome to the club that nobody wants to belong to. We've all been there. We are here. Some of us are still here after 10 years. And boy, when you've never known anybody who had kidney cancer and the odds look bad, to be talking to someone who got the same news and is still alive 10 years later, it's world-changing in terms of. They said there's no cure, but this stuff, high-dose interleukin-2, sometimes works. It usually doesn't. It usually just goes right through people. But for 15, 20% of people, it has an effect. And for half of those, it's complete and permanent. Voila! This is my long shot that worked. You think I'm going to go for that? You bet. But watch out, the side effects are severe. They sometimes kill people. Well, that's good to know. Don't let them give you anything else first. And here are the names and phone numbers of 4 doctors in the Boston area who do it. Now, ladies and gentlemen, I assert that from the point of view of the person who has the problem, this is useful information. To this day, none of this is in the medical literature. Think about that when somebody in your family gets sick. It does not replace the medical literature. Heaven knows, I mean, more people like me are surviving to be older and older and older. You know, you get on an airplane at the airport these days and there may be 6 wheelchairs lined up because there are so many mobility impaired people who are still healthy enough to travel. Well, side effects are severe. The sign of the disempowered, powerless person is that they'll say, well, there's nothing I can do. All right? An empowered person, like me, I didn't know it was called being an empowered patient, says, okay, doctors, how do I prepare for the side effects? My oncologist said, that's a good question. Nobody has ever asked us that before. Notice I didn't go to the internet first. I went to the doctor. Then I turned to the patient community. I got 16 firsthand stories from people who'd been through it. And it wasn't enough to build any new medical facility out of, but it was much better than nothing. Well, to make a long story short, there's a whole separate book of my cancer diary, which for unusual reasons is titled Laugh, Sing, and Eat Like a Pig. But that's 50 weeks later, there's that same tumor. Immunotherapy, when it works, they didn't have to cut me open. You know, they cut me open to take out the kidney, but all the other tumors disappeared over the course of the next 2 years, even though the treatment was only 3 months long. This immunotherapy is amazing when it worked. The next hippie change thing that struck me was when the BMJ, the British Medical Journal, wrote to me a few years later. They'd heard about my story of getting help from other patients online and asked me to write my story up for them. So they published it, which was amazing. Now, so here's the social change agent in me. I'm thinking, all right, I get to tell my story, but more important, there are going to be a whole bunch of doctors who read this because it's in the BMJ. So I asked my oncologist, what would you want other doctors to know about my case? And what he wrote was quite a surprise. He said, you were really sick. I don't know if you could have tolerated enough medicine if you hadn't been so prepared. You know what he meant by that? He meant how I was actively investigating the side effects, so when every one of them hit, I had some idea what was going on. He was accustomed to practicing in a way where when every side effect hit, everyone would kind of hold on to the railings and just hope. And he has since said he wishes that he could bottle how I acted so he could prescribe it to other patients. And you know what the real punchline is? How's this for participatory medicine? Today, they have a booklet on how to cope with side effects. Isn't that great? They took the idea from patients, co-designing the future of healthcare, patients and doctors bringing different skills to the case. So here's a question. How could it be that the most useful and relevant information could possibly exist outside of the medical literature where we're all taught to look? And it turns out, to make a long story short, I've written entire articles on this, because of the web, and this is where Tom Ferguson's mental contribution is such, someday he ought to get a Nobel Prize in my opinion. Because of the web, patients can connect to information and each other in ways that were not possible a generation ago. It has altered what's possible, which made my outcome possible. In fact, the metaphor that I eventually realized, I know scientists are taught to think scientifically. Just saying, ooh, patient empowerment, kumbaya, everybody think lovely thoughts, gets you nowhere. If there's something real happening here, some people say patient engagement is the blockbuster drug of the 21st century. Drugs are required to have a mechanism of action. What's actually happening here? What I realized after using this slide for several years is information is precisely analogous to a nutrient that enables a healthier response where it's present, and these social media dotted lines are exactly like capillaries. They are the information capillaries through which information nutrients can reach a point of need. Now we can understand, rigorous scientific thinkers can understand there's something real that has changed, and it alters what's possible. The next follow-on effect that's happened is we have a generation now of patients who are accustomed to getting their hands on information. It's really sad when a doctor says stay off the internet and doesn't actually understand this. Right? And they're starting to speak up and say, well, this side effect is more important to me than that one. And in terms of designing medications and running clinical trials and all kinds of things, consider this. There's a man who got diagnosed in the same month I did, and he got the same treatment. Several years later, he had a recurrence. I've had none. And to him, there were now 4 medications available, where before there'd been only the one. To him, the most important side effect, the most important factor, was that at the same time his wife got diagnosed with metastatic breast cancer, and he was going to be the primary caregiver for her. And so the most important factor for him, which would never show up in a clinical trial, is his own fatigue level. We are now in the era where the blockbuster drug, where you come up with one invention and you sell $60 billion worth of it has pretty much run its course. And now the greatest value is in being exactly what individuals want. Right? So there's a whole separate discussion of that. Question, who gets to say what's important? I mean, if the microscope's happy, saying, oh, good, your biopsy looks better, but the patient is miserable, has care been achieved? How would you like it if your kid was crying, but him or herself to bed every night to sleep because it hurts so much, even though the doctors are saying, hey, you look good to me, you know? Well, so this is where, in Sarah's slide this morning, what matters most to patients and families? See, this all fits together as we retune the entire industry. Here is a great thing if you want to explore this, especially if you've ever had sickness in the family. Don't worry about trying to read this. We'll get to it. There's this great article called The Taxonomy of Burden of Treatment that came out a few years ago. There's this incredible graphic. They interviewed thousands of people in different countries and basically cataloged in this big circular diagram the categories of different kinds of burdens. Like up at the top left there, you'll see personal factors, and under that you have their beliefs, religious beliefs, preferences about their treatment, and so on. Next to that, there's a bundle of things having to do with relationships with others. I feel like I'm a burden for other people. Let's look at another close-up, relationships with healthcare providers. And here's where you can start to understand why what is most precious to some individuals is different from others. I've suggested to some groups, I'd just love to see them take something like this into a meeting, a clinical visit, you know, and use it as a discussion thing. And if you do this right, it's beautiful how this can work out, all right? A Dutch IVF program at the university in the Netherlands where I did my TED Talk. They had a crazy idea. I've been to this clinic. It is not a happy place. People are at this in vitro fertilization clinic because their dream of holding their own baby is dying, and this is their last chance. It's rough to be in a waiting room full of people who look hopeless. They gave their patient community a wiki, an online discussion group, and 6 months to talk amongst themselves. And the promise was, whatever you people do, decide together, we will give you your top 10 choices. So, because I mean, they're sitting there, they can't always give people their dream, but they can at least listen along the way. Now, in the American health system, of course, we have Dr. House, whose reaction to this is, are you kidding me? Right? That's nuts. Well, what did they come up with? The top two things were basically that they wanted insurance in the Dutch national health system. They wanted insurance to give them more attempts, more fertilizations. Don't count it as an attempt if there hasn't actually been a puncture, you know, a replacement in the embryo. The third thing, if they could have anything, was empathy from their doctors and nurses, not just information. Somebody who would sit there and say, I know how it feels, or just be with them. Sometimes they end up having to give up, but somebody who can, well, but the fourth thing was what really got me. Separate waiting rooms for women who'd conceived so that the ones who hadn't wouldn't have it in their face. How much does that cost compared to the total cost of care? And yet this is what emerged out of just listening to the patients in co-designing care. Who knows how much expense was saved by just doing this instead? As Sarah said, context is everything. How will this impact me and my life? I'm going to come to a close now in the next few minutes. This mug went around Facebook a couple of years ago on an emergency room doctor's page. Please don't confuse your Google search with my medical degree. Well, some people might, but I don't. The e-patient response, though, we piled on saying, dude, Googling is a sign of being an engaged patient. So many doctors say, I wish my patients would get off their butt and be more engaged. We try to go learn something, and you say, stop that. See the silliness? And yet you can see it from both people's sides. Predictably, the empire starts to strike back. I have no idea if what I'm about to show you was a direct response to my talk in Brussels in 2012, but a year later, the Belgian government, it was a Belgian government event, the Belgian government started running Google ads that if you Google a symptom in Belgium, The top paid Google ad was a link from the government saying, don't Google it, and linking to a professionally produced video of husband hurt his finger, mama applies a bandage to the owie, but then, she goes on the internet and starts Googling hurt his finger. Notice he's starting to have imaginary tumors growing out of his forehead, and within the 60 seconds of the commercial, they've convinced themselves that he's dying. I'm not kidding, you can look this up. Belgian government, don't Google it. There were 2 of these commercials, and it's not just them. In Israel, the biggest HMO ran this TV commercial, Search Victim. A friend of mine in Israel helped translate it and produce subtitles. Search Victim. Here comes the anxious man into the emergency room. The wife brings him in, and the triage doctor says, how much did he ingest of websites, right? And she says he swallowed every word. The ER doc says, clear, and slams the lid on his laptop, and he's all better. This is culture war, baby. It's like game on. But meanwhile, evidence grows that the current paradigm is collapsing. All right? This was 2015. This young woman, 19-year-old woman in the UK named Bronte Doyne, her liver cancer had recurred. The doctor said that's not possible. She and her mother had been Googling and found that this kind of cancer can recur now. They told her, stop Googling, and she died. They complied, and she died, and the doctors now admit fault in her death. Stuart Brand, once a new technology rolls over you, if you're not part of the steamroller, you're part of the road. And I'm going to run a couple minutes over, I'm sorry. This is how it all worked out for me. This is a photo of me on the night of that shoulder x-ray, or that physical exam. This is a guy who was dying of stage 4 cancer and didn't know it yet. At Halloween, the following year, my treatment had finished, and somebody snapped this picture at the Halloween office party. I was happy, because I was grinning at the ghoul. I'd pictured my mother's face at my funeral, and instead, 2 years later, here we were laughing on the day when I did get to walk my daughter down the aisle. And I'll tell you, I was so glad she didn't have to say to her mom, I wish Dad could have been here too. I love good medicine. And a few years later, she's a digital native, does everything digitally. She gave me the world's worst jigsaw puzzle for Christmas. She had made a jigsaw puzzle out of her ultrasound, which was her way of telling me that I was going to be a grandfather. And this child, I'll tell you, there she is in the back seat of the car, okay? She has no clue what's going on. She's strapped in a rear-facing car seat, being taken. She doesn't know what a car seat is or anything like this. Paternal care is exactly what somebody needs when they can't comprehend what's going on. It's what we needed as patients a century ago when we had no way of knowing anything useful. But if she were kept in the back seat of that car, instead of being allowed to start taking an active part, she would not have gone on to last year when she entered preschool, and this year now she's in kindergarten. And believe me, she has some opinions. When she was age 3, her grandmother scooped her up and put her on her shoulder, and Zoe said, this wasn't really part of my plan. Who knows where she got that kind of thinking from. Protecting lives is important work, all right? Prince died because of polluted medication. Granted, it was illegal drugs. Tom Petty died because of polluted medication. As I've learned about what this company does, I've come to see every time I ever put a medicine in my daughter's mouth when she was growing up, I counted on it being the authentic thing. This is such important work. Thank you for what you do, and please let patients help say what's important. Thank you.